We are live. Dr. Jen Unwin, clinical psychologist and expert on psychology in chronic illness management. Now, welcome. Thank you so much for joining me to chat. I'm super excited. And one of the main reasons I'm so excited is because there's so many experts out there. And the stories that I've heard about these experts, myself included for many years, are that they go down, not to say I'm an expert, but just that I'm like in the game. Is we go down this road and we talk about like the food journey we're on and how we eat clean and we practice all these things. And one of the questions the crowds always ask are, how does your family eat? And how does your wife eat? And for many years, I had to say, well, no, they just want chicken nuggets and chips, and my wife doesn't care. And what I love about your story is that you and your husband have almost become famous together, because you do this together. And obviously, for those of you not watching, Dr. David Unwin is a clinician, a neuropsychologist, a GP. Yes, my dad's a GP as well. He always used to say, I'm just a GP. So I'm sure that's something David can relate to. But what is the story behind it? How did you both end up like doing psychology and then general practice medicine and then end up in obesity and chronic ill health?
Doing it together, yeah. Well, so I trained as a clinical psychologist, and I practiced in the sort of physical health arena. So most psychologists obviously tend to practice in mental health or looking after people with learning disabilities or maybe older people with mental health problems. But I'd always really liked working with people with physical health problems in the big hospitals or in primary care. So that was me. And then alongside, obviously, David had trained as a GP, and he was working here in Southport in a practice of 9,000 patients. And we both ended up working in Southport. I was in the hospital and he was in primary care. And then it sort of crosses over with my own journey, which is a sort of lifetime of struggles with food and weight and yo-yo dieting and, obsession with food and all of that, which I'm sure a lot of people can relate to. And it'll be 10 years ago now that I stumbled across a book called Escape the Diet Trap by Dr. John Briff, who was also a UK GP. And I read that and I understood he explained the science, which made lots of sense to me. It's not about calories, it's about the things that you eat and the way that affects your hormones in your body. So I thought, right, I'm trying this thing. I'm trying this low carb, no sugar, no grain thing. And felt pretty bad for about a week because I'd always been very high carb, low fat, following the guidelines. But after a week, I felt amazing. I wasn't hungry. The lights came on. I felt so much better mentally. Started losing weight. Was doing really, really well. And of course, David had seen me through this journey.
So you were already married at that point.
Yeah. So we this year celebrated our 25th wedding anniversary. So he'd been through over 15 years already of this kind of up and down and food and am I eating that or not that. So that was the first thing. And then the other thing was that he'd got pretty disenfranchised with not being able to help people who were overweight. There was more and more people with type 2 diabetes on more and more medications, and they weren't well people. They weren't getting better. So that was in the background, and he was thinking of retiring. So this is 10 years ago, he was thinking of retiring.
Wow.
So this led to a sort of conversation around, well, this is really interesting, that after, for me, kind of 50 years of struggling, this has made such a massive difference. And also there he is all kind of, fed up, feeling he's not really helping his patients. So we said, why don't we do a joint project, which we'd never done. And I said, we'll do it as a group, because I love running groups. And I think groups are fantastic ways of helping people to change their behavior and sustain it. I think that's wonderful. But of course, GPs don't run groups and would sort of run screaming at the thought because they wouldn't know how to manage it. But I knew how to do that. So we, in our own time, set up the first group to help people with pre-diabetes. That was how we started. And that led to the first paper. And the results have been remarkable. The project's still ongoing. David's still working in the practice. There's now 117 people with drug-free diabetes remission in his practice alone, and they save upwards of £60,000 a year on the diabetes drug budget at their practice compared to other practices in the area with the same similar sort of population. So it's been fantastically interesting and has got us, tickets to talk all over the world really about that project, and about not just how you help people to make that change, but how the vital thing I think is how people are able to sustain it, because it's okay, going low carb for 6 months and putting your diabetes into remission, but unless you keep doing those same behaviors, you're going to go back to where you started. And so long-term remission is our goal now, really, for people.
There's so many directions I want to go now. Before we go into the actual stuff that you talk about, the behavior change, because I read that's like kind of one of your things. I wanted to ask about the group science. You said that groups work, and when we run groups, and we just know they work based on some kind of coaching methodology, and just know like accountability works. But is there science behind that why group dynamics actually work so well?
Yes. So things like so Joe Nifland, who's also in the sort of food addiction space, talks about this idea of mirror neurons, so that when what we tend to do is sort of see what other people do and then do that. And of course, from an evolutionary point of view, that worked really well in the tribe. If everybody had the same sort of culture, we all, that's how you do it because those people are doing it. And of course, in the society we live in now, the environment we live in now, unfortunately, the main messages we're getting are, eat McDonald's, treat yourself to an ice cream, because of all the advertising and all the ubiquitous, it's everywhere nature of junk food and the normalizing of it by the food companies. So we all think that's normal. So if we can get people into groups where there's a different norm, which is that we're eating in this way, we've got this sort of group identity, that can really help people. And the accountability piece. And I think there's just a big thing about sort of hope, which is my thing, which is if you see, so we have people in our group who from the original cohort, so they've been doing it for 10 years, and they've been 10 years diabetes drug free. Some of them have lost, we talk in stones, they've lost 8, 9, 10 stones in weight. Their lives are utterly transformed.
And a stone in pounds?
It's 14 pounds in a stone.
Okay, so it's like 7 kilos.
Yeah. So
10 stones, that's 70 kilos. That's like almost a me.
It's a person, yeah. And obviously that's transformed their lives. So when they come along to the groups and other people hear their story and they think, oh, that guy only lives down the road from me, and he's my age. I think if you can identify with someone else who's walked this journey, it makes it so much easier to think, well, I could do that too. Whereas if a psychologist or a doctor says, I think you should do this and it'll be good for your health. Yeah, that has an impact, but there's something about identifying with someone else's journey and it being the same as your journey and seeing if they can do it. It makes you believe it's possible. So that's something about, but believing in this sort of better future that you could achieve if you do what they did. So,
what do you think it is that contributes the most to this pattern of behaviors? Do you think it's the media, or do you think that in some cases it's the way that we're raised? Because I know that addiction talks about environment, but also a lot of demons that we carry from throughout our life.
For sure. So so the whole addiction thing is sort of really interesting. So there's definitely a genetic factor. We do know that in those of us who really struggle, who have that really addictive relationship to food and have to abstain really to have any sense of control. Yeah, there's definitely a sort of familial pattern to that, and it may be that there were people with other kinds of addictions in your family, so you've got that sort of brain that responds in a certain way with the dopamine that makes you crave those things. So there's definitely a genetic factor. So obviously there's definitely a family factor, and people often talk about, you know, that in their family food was, you know, I know it was for us, food was everything, you know, being fed, celebrations, certain things that you had on certain occasions, being kind of treated with certain kinds of foods. So that can definitely be a factor as well, you know, that sort of emotional connection to food. And then because sugar's really the only psychoactive substance that children can get their hands on, so we don't give them alcohol and nicotine or anything like, you know, not even caffeine really. We wouldn't give that to children, would we? But we
some people put Coke in, I mean, in South Africa they put Coke in the like milk
bottles. Yeah, so caffeine, yeah, maybe if kids are having Coca-Cola, but you know, sugar's the one thing they can get, and it's kind of even encouraged, isn't it? Oh, you know, you've hurt your knee, have a biscuit, that will make it better. And so that can set up in the brain these kind of craving pathways that are then already there. And also if kids are maybe in a difficult situation or something traumatic happens and they're using sugar as a sort of way to calm themselves down or to be a soothing thing, you know, whatever the situation might be at home, obviously that can then further complicate as an adult one's relationship with food, because then when you're in a stressful situation or, you know, something difficult happens, that'll be the sort of go-to thing to reach for. And it can be a sort of gateway to other things as well. So if that's so Eric, there's a wonderful clip on YouTube of Eric Clapton talking about his drug use, and the guy says, you know, when was your first experience of drug use, thinking he'll say, you know, when he had cocaine when he was 22 or something, and he says, you know, when I was 6 I used to just eat sugar. Wow. And he says that was the start, you know, using sugar to sort of soothe himself. I think it was 6, can't quite remember. Using sugar to soothe himself then became using other substances like alcohol and so on to soothe himself. So yeah, that reliance on something external to calm us down can start very young.
No, so there's two things going on here, because there's the biology and there's the sort of habit. So we get into that. I mean, Dr. Cybus talks about the effort-based reward system. You know, and I don't know if that's like a different framework or whether they all fit into each other, which I find really cool, by the way. I've been thinking a lot about that while I'm like running, and he mentioned being creative as one of the outlets and then connecting with people. I'm trying to remember the last one.
It's trying to get your so I talk in the book that we're going to mention a bit, I think, about getting your daily dose, which is dose stands for dopamine, oxytocin, serotonin, and endorphins. You know, rather than getting those through food, you know, we need to get them, like you say, exercise, connection with other people, being creative, whatever it is, those sort of human activities that aren't anything to do with just getting a quick fix, like, you know, scrolling on your phone or eating or drinking something, or, you know, whatever it is. So yeah, so it does definitely fit in with what Rob talks about, which is if you're going to there's two. So first is the abstinence, staying off the substance, the sugar and the grains and the ultra processed food. But if you're taking that away as a way of sort of feeling good, you're going to have to replace it with something else, something more functional, because otherwise you're going to really struggle initially.
Yeah, well, this is one of the places I get stuck when I'm trying to explain it to people, because that in itself sounds like, you know, if I just watch my kids, like obviously during lockdown they had too much TV, and they to an extent have suffered in that they have not corrected fully yet. where they don't know necessarily how to like keep themselves entertained or how to soothe themselves with the daily dose. You know, they're like, it's like it's like dark outside. And they were awake and they're like, can we watch TV?
No, definitely.
And so like where I'm curious is how much of that is nurture and environment, and how much is actually biology? Because from what you're saying, it sounds like people learn to soothe with sugar, then that's like the habit that they form. But then I've heard you and I think it was Bitten and Joan, when we had our panel discussion at the World Nutrition Summit, they were talking about it being, you know, it triggers the pleasure center in the brain and actually changes the biology of the brain. It's like a double whammy. How does that happen?
Yeah. So what happens is, you know, various things really. One is that so when we have sugar, I mean, dopamine is probably the main one that's sort of easiest to explain. That obviously for survival purposes, it's good that we enjoy eating, isn't it? So there's already a bit of dopamine when you eat, because it's good to have that feeling of sort of reward and pleasure. But you get a really big spike with sugar and sweet foods, because obviously it made sense from an evolutionary point of view that if we ever found anything sweet, honey, fruit, or carbohydratey, starchy, tubers and things like that, it was good that then we would really enjoy that, and we'd remember where it was, and we'd be motivated to go out even if it was a cold day and find some more of it. So it would be good to have a big old spike of dopamine. But of course, the kind of foods, the hyperpalatable foods, very high in sugar, like you say, maybe linked with caffeine, we get a massive dopamine spike. And the brain doesn't really like that. Like the rest of the body, it's always trying to keep a bit of a balance. So what it does is knocks out a few dopamine receptors so that the dopamine is there, but it's not sort of impacting the brain quite as much. And that's exactly what happens with tolerance to alcohol, where you need more and more to get the same effect. So the same thing's going to happen with where you need to have more and more to actually get the dopamine hit, if you like. But you can see that getting rid of your dopamine receptors is actually not a good idea, because we need to have those receptors available to dopamine so that we can feel cheerful and motivated. And when our dopamine is low, we feel unmotivated and not at all cheerful. And a similar process with serotonin. And serotonin's that neurotransmitter that they try and correct with antidepressants, isn't it? That's trying to raise the available serotonin. So if you have a lot of sugar, the available dopamine and serotonin is going to go down over time. And we've seen this from the research that people who eat high sugar diets are actually more depressed and anxious. And that's why, because they're actually depleting those things over time. And they're on a sort of, they're in a trap, basically trying to get some dopamine and serotonin by having the sugar, but at the same time, it's depleting it over time. So it is a horrible trap where you're just becoming sort of more depressed and more anxious and more focused and stuck on the food. Whereas actually through abstinence, then everything's going to sort of, and a good nutritious diet, the brain's going to sort of, get back to its sort of more normal levels, if you like. And then we can pursue those other activities that give us our daily dose of dopamine, oxytocin, which is the closeness neurotransmitter, serotonin, and endorphins, which are the natural painkillers, which we do get a lot from exercise. So and and what's happening is that there's this sort of rewiring going on between the primitive part of the brain, the sort of reptilian part of the brain that's driving you to do these things like a survival mechanism. And it sort of dampens down the frontal part of the brain, which is the part of the brain which is the sort of logical, thinking it through part of the brain. So other people might recognize this. Like this used to happen to me when I was in the food and in the sugar that I'd say to myself, right, I'm not having any biscuits today. And I'd get home from work and I'd sort of watch my disembodied hand go and grab a biscuit, and I'd be thinking, I actually didn't want to do that. It's almost like you're being driven by this the sort of primitive survival part of your brain, which has no language. It's sort of pre-language, so you can't argue with it, and the logical front of you part of your brain can't override it. We end up doing things against our better judgment, and that's part of how people with these eating problems can become very disheartened and hopeless and sort of shameful about the fact they can't control their own behavior. I know I used to feel like that because, you know, I'm a psychologist, and I used to think, why can't I stop doing these ridiculous things with food? And now I understand the brain chemistry and the addiction model of food addiction. I know that was never my fault. That was real biology and the food industry kind of, you know, got together in this horrible horrible circumstance and sort of hijacked my brain. So
exploited all of those weaknesses.
Yeah, exactly. And if we could take the power back and you know, it's not I'm not saying it's easy to take the power back and don't eat those things, eat real foods, which is what you're all about, and, you know, nourish the brain and the body with the foods that it needs, not food as entertainment or soothing. Or now it can take quite some time to change these behaviors, and we're bound to slip up multiple times along the way. But if that's your determined direction and support, as we were saying, there's loads of communities now or people offering support for people to change their behavior over the long term. It is possible to get yourself to a much better place. Anyone who's listening who's still struggling, you're not alone. Just keep going.
Well, so the obvious question is, what do you guys do at your thing? I mean, at the practice. And just for anyone who's tuning in now, you have 117 people who are living with what do you call that? Diabetes in remission, living without diabetes.
Without diabetes. When they did have diabetes and they were on drugs, but they've managed to reverse that, and now they're living, you know, just like you or I, really, without diabetes, and often a considerable weight loss, and sometimes coming off other medications like blood pressure meds, etc.
So how does your process work? What do you do?
Yeah, it's like combination really of the physiology. So obviously they would get an appointment, they'd just turn up in the practice, and David would maybe do a blood test and find out, you know, that something was going on, or they'd come and they'd be worried about their weight or whatever the problem was. And he would explain the physiology to them about sugar and insulin and the effect that has, you know, in terms of storing body fat and so on and so forth. So he explains that. And if you just Google, if you just put up David Unwin into YouTube, you'll see him. There's loads of his lectures up there. There's lectures from the Public Health Collaboration and so on about him talking about how he explains the physiology. And he came up with these little charts that some people might have seen, the teaspoon of sugar charts.
Yeah.
Have you across those, Jonno? Where
I've seen many. I think we've got our own teaspoon of sugar charts as well. Oh, there we go. I've got it. Is it phcuk.org? Is it public health? Yeah. So go on, I'll pull it up.
Yeah. So there's videos that we've done for them. They've got a YouTube channel, and also all of David's resources are there for free. So anyone who wants to see the diet sheet or these sugar equivalents. So it's explaining to people exactly like you would as well. Like, you know, so in a reasonable serving of basmati rice, there's over 10 teaspoons of sugar, which is always astonishing to people.
That's double the daily recommended allowance for sugar by the World Health Organization.
Exactly. And also I love to tell people that in an adult's bloodstream at any one time, there's only about 1 teaspoon of sugar. So, I mean, the body can actually make its own sugar. But anyway, why would you need to eat, you know, has it got a banana on there? Yeah. So banana's nearly 6 teaspoons of sugar. You know, nobody actually needs to eat a banana. have one if you want. And if your blood,
but it's got potassium in it. You need the potassium. Otherwise, you'll get a nutrient deficiency.
Well, I'm in trouble then, because I've probably not eaten a banana for 10 years.
Wow.
So this sort of educates people. And then we have, and I've trained him to do all the psychology bits as well, because I don't actually work in practice. But then we do have groups. They were in person, but with COVID, we've gone on to Zoom, where people come and they ask questions. We see how they're going, swap recipes, give support, that kind of thing. So that's really what goes on in the practice. And over time, all the other doctors reluctantly, you were talking about, weren't you? It starts with us, and then over time, the practice nurses and the other doctors have all adopted this way of working, just because they saw the results, and they couldn't believe how good the results were. So over time, they adopted it.
It's incredible. And I don't know if there are other cases. I don't have my ear on the ground in the UK, but it sounds like something that'd be difficult for the NHS to ignore. I was on Diabetes UK's website this morning, and they were saying that, you can do low carb, but the Mediterranean diet's better. In fact, there's tons of stuff just saying Mediterranean, because you could get a nutrient deficiency. But I've never heard of anyone actually living in remission on the Mediterranean diet. And this is it. Like, this is happening. There's a study, and it's by a doctor on the NHS. Like, what's happening there with the public health side? Yeah.
It is growing, but sort of, I would say, more from the ground up than the top down. So there's David's got a whole Google group now of doctors in the UK who are interested, hundreds of doctors and practice nurses.
Oh, wow.
A paper's recently come out with the British Dietetics Association saying that low carb should be given as an option to people. It's a perfectly valid option. If you look at the guidelines from the American Diabetes Association, for example, they've all adopted it now. So, and a few years back, there was nothing at all about low carb on Diabetes UK. So, things are kind of slowly going in the right direction. And I think individual patients are discovering it for themselves, either through the internet, or they're reading a book or whatever, and they're doing it, and they're sort of almost educating their own doctors. So things have come a long way in the last 10 years. We didn't realize we were doing anything sort of controversial until our dietitian walked out and didn't come back. And also David used to get attacked at conferences and sort of vilified for it was so dangerous what he was doing.
Heresy.
But I think that the strength of our project is that he's collected data on everything: blood pressure, lipids, liver function, kidney function, like anything you want. He can look at the data of the cohort who are doing low carb, and they improve on everything. So we got, the lipids are going to go haywire, you're killing people with heart attacks, and then that clearly wasn't the case. And then they're all going to get kidney disease because they're eating more protein. No, the kidney actually improves over time. Wow. And mostly people with diabetes, their kidney function worsens over time. So it's doubly good. It's not even holding steady, it's actually getting better. People's liver function dramatically improves. So that's what's kept him safe, really, and made the project so interesting, is that there's all this data to look at.
That's great. So on the psychology side, which is
probably the most amazing result, is that if you get people within the first year, they nearly all can put their diabetes into drug-free remission. There's something about getting people earlier before there's sort of too much metabolic aging, if you like, or metabolic damage. Pre-diabetics, they nearly all go back into the normal range. Those that adopt a low carbohydrate lifestyle, and people within the first year, again, it doesn't seem much to be to do with age or gender or anything, but more how long has your blood sugar been in the poor range. The faster you act, the more likely you are to get reversal.
Amazing. So one of the conversations we have quite a lot internally is around the addiction model and its role in food addiction. And there's constant debate about, whether there isn't a different model, because it seems like alcohol, it's simpler to just quit alcohol than to moderate. And it's, when you're talking about cocaine, it's like, look, it's not going to make your life any better. So it's kind of like a net positive, but you can't quit food. And so I'm curious about what life looks like for someone who, and maybe you can walk through like if there are any stages, but what life looks like from someone who's like an active, sugar addicted person who's struggling with their weight and has all the other stuff along with it. So like low self-worth, struggling with maybe body image, and then they end up living freely. Is that possible? How does that transformation look?
I'm so glad you've asked that question. It's one that I love. Yeah. So who was I listening to recently was saying who's had loads of addiction problems, and they said, actually, do you know what? Food addiction is the hardest nut to crack. Oh, I know who it was. Susan Peirce Thompson, who wrote Bright Lines Eating.
Yes,
she was on a podcast talking about this. Yes, exactly that. So with other addictions, we don't even have to kind of be around it, do we? I mean, say your addiction was cocaine, you can completely avoid the people that are going to sell it you, or it's never advertised to you. Same with alcohol, a little bit more difficult, but you can stay out of the bars, you can not have it at home. It's a little bit, it isn't advertised like it used to be, is it? And cigarettes aren't either. These things have all been regulated. Now they're all cigarettes in the UK are behind a grey screen, it's like furtive, you have to go in and get it. Whereas right at the till, there's all the sugary sweets, and they're offering, even as you're paying your bill, they're saying, would you like 2 chocolate bars, it's super cheap today. They're doing that all the time in the UK. Like, no. So it's super hard because the addictive foods, it's not all foods, obviously. It's sugars, grains, and ultra processed foods on the whole. Some of us have a bit of a struggle with dairy, so cheese and also nuts can be problematic for people to sort of overeat. And in fact, some of us, and I'm one of them, have had food issues for so long that we could actually overeat most things. So I could overeat meat and fat if I'm not careful with myself. I can have a sort of reset my appetite somehow. So that's why it's super problematic. It's the drug we have when we're young. Our brains are wired to it early. We associate it with emotional stuff. Now, if you say to someone, I'm giving up cocaine, they say, good for you, good decision. If you say to people, I'm
good decision. Yeah.
Say, are you mad? You're going to have a heart attack. So we don't even get, on the whole, supported in making this change. It's a countercultural change. So that's why food addiction is the super hardest to have. Hats off to anyone who manages to make that change and sustain it long term. As I say, it's not easy, but it definitely is possible. So, I mean, my advice is really to focus on real food, which I know is your guys' message as well. So, things that were swimming or walking around the field, or things like eggs, meat, fish, all of those sort of ancestral foods. Buy the best quality you can. Treat yourself. Base all your meals on those. Be cautious with nuts and dairy, because they are sort of overeating type foods. So nuts were obviously around in the autumn. They were things that we used to get fat on. Same with fruit, and dairy, milk and so on. It is actually a growth food, isn't it? It's to grow little cows into big cows. So the idea is that it's delicious.
I've never actually heard that before, but that makes perfect sense. I can't believe I've never heard that. It's a growth food, obviously. It's anabolic.
And also, it's delicious because it's got that lovely fatty, consistency. So particularly when it's made into double cream, for example. So some of us have to be a bit careful with that. So and then what we get, those of us who previously had, so when you're in the active addiction, there's cravings all the time, thinking about food all the time, trying to restrain yourself, feeling bad that you've eaten the things that you didn't you don't want to eat, feeling bad that you're putting on weight, although it's not all food addicts are overweight, some are normal or underweight. Doing other things to try and control it, like excessive fasting or excessive exercise, and then spending half your life kind of on a treadmill, you know, all of these sort of compensatory behaviors. There's a massive overlap with binge eating disorder, and somewhat of an overlap with bulimia and other eating disorders. So it can be quite a sort of complex picture. But yeah, focusing on real foods and meals and not snacking, and not food as entertainment. And as we already talked about, like Rob Sivers says, working on how are you managing your life and your stress, and what are your connections and the support that you've got, and sort of putting all that together, if you like. And yeah, just keep going, keep trying. You're bound to wobble and sort of fall off the wagon occasionally, but just draw a line, analyze it, why it happened. You know, was it because you were stressed? Was it because you're on holiday? Was it because you were socially pressurized? Or, you know, why did that happen? Reset, make a plan, go ahead again. Yeah.
So you mentioned something there, and in fact, the diabetes, I read so many, I can't actually remember which one. I think it was the American Diabetes Association, the consensus letter, or that report. Anyway, they all say that you cannot reverse or manage. They talk about managing it, you know, diabetes without forming a healthy relationship with food, or actually taking an interest in food. They said you have to take an interest in food, so you have to learn how to cook delicious food, and it has to be pleasurable and whatever. But then one of the criteria for food addiction, I think food addiction is eats for pleasure. So it's like there's such paradox there. It's an impossible question for me to answer. When people say, yes, again, I have to form an interest in real food and fall in love with food again. But then one of the things that shows me that I'm an addict is that I eat for pleasure. And now you're telling me I shouldn't eat for pleasure. So how do you explain that to people?
You know, definitely you should enjoy your food. Like it's a survival thing, eating, isn't it? As we've said, you should really enjoy the real food that you eat, and you cook, prepare it beautifully, sit down and have a proper meal. Don't eat standing up. You know, all of these behavioral things that we've slipped into, eating in the car and all of that. No, have a proper meal. Yes, enjoy it, because we're wired to eat. It's important that we eat mindfully and enjoy it, and sort of savor it, if you like, because in that way we register that we've eaten. You know, we can notice when we're, you know, properly full. We're not just kind of eating at the desk. And no, so you should definitely, yeah, I love food still. I'm still a foodie. I enjoy what I eat. I still love cooking. I just kind of do different ways. So it's not food as entertainment. It's just food as delicious nourishment, if you like.
Right.
And yeah, enjoying your food wouldn't be one of the criteria for addiction. That's more sort of cravings that you can't resist, is more, you know, it's more the addictive thing. It's cravings you can't resist, eating more than you intended, giving up other activities to focus on just eating. Always, you know, losing control of the amount, getting withdrawal symptoms when you can't get your hands on it, and then continuing to eat stuff you know you shouldn't, even though you know it's harming your physical or mental health.
Yeah.
So that's how you describe addiction, really. So it doesn't really say anything about, it's still okay. It's still definitely okay to enjoy your food, because otherwise it's not sustainable. So if people are going around just eating, like, you know, sad dry chicken breast salad, it's a diet, isn't it? And you're never going to sustain that, because it's not enjoyable. So for me, long-term food addiction recovery is really enjoying your food, getting the right amounts of meats and fats, and eating your meal, and then just getting on with your day, doing something else, rather than thinking about what's the next meal.
Totally. So I want to ask you about trauma, which is often something that people might not feel comfortable talking about in a group setting. But there was a study they did on a clinic in America. I can't remember. It was in Johan Hari's book about depression. And this, and in fact, I think it was also in his book about addiction called Chasing the Screen. And he spoke about this clinic where it was a fasting clinic. So they basically let people eat nothing. And then they would be on a nutrient slurry, essentially, for a while. And many people lost over 100 kilograms, like a lot of weight. And then months later, and they were mostly women, they came back. And a lot of these people put on all the weight and like really fast, like within 3 to 6 months, they put on, over 100 kilograms. And then they decided to actually study this group of people who had been through who had all put the weight back on. And they found that 55 or 60% of them had been abused.
Yeah.
And I'm not saying that like all of our clients have been abused, but what does fascinate me is that there is a lot of trauma that never ever gets addressed. And so no matter how much willpower or group support or accountability you have, it's almost like there's this muscle that kicks into gear, just says and like freaks out and then reverts. Could you talk about that for a bit?
Yeah, for sure. So number one, just to say as well, is that fasting isn't a great idea for people with food addiction, because they do that bounce back thing where they've you tend to think, you tend to feel quite good when you're fasting because you're not having to think about food. But then once you stop, you're going to probably that survival thing is going to kick in. You're going to overcompensate, put the weight back on. So fasting isn't intermittent fasting is okay, but long-term fasting not great for people with food addiction. Yes, there's an interrelationship for many people between the food addiction problems and this, as we were saying before, sort of eating to soothe, and a trauma, or that might be when, maybe as a child or even later on, the problem was really sort of concretized for them. It really became a problem after some sort of a traumatic event. So there's a couple of things to say. One is that oftentimes if people can actually start to manage the food and understand that the sort of brain problem with addiction, sometimes what you do find is that actually their mental health is so much better that they're then able to process that to process that trauma in a better way. It does come back up for people, but they're then able to sort of, like, with their healthy brain, then make better sense of it, or sort of talk about it and not necessarily sort of need extra help. But you need to do that first. You need that period of of a sort of good food to heal the brain, to be able to sort of benefit from being able to then talk about the trauma, if you like. If somebody's really, really in the food, and sometimes then also on, medication, maybe psychiatric medication or whatever, it's then it's a bit more challenging to reprocess that trauma memory, even if you're working with an expert, because you're still altering your brain, if you like, with the substances. So it's a better idea to address the food first and then address the trauma if that's needed at a later stage, to get some help with that. Okay. Some people do need one-to-one for sure.
Yeah. And so what it sounds like is, I think you're on the same page. How do you think the UK or the NHS is dealing with, maybe this is the wrong way to ask the question, but what is your opinion of including psychology as one of the most important elements of lifestyle change? Because that's obviously what you do, right?
Yeah.
I almost think everyone should go to therapy. It's like you've got to wait until you should go to therapy.
Yeah, or not therapy necessarily, but at least have that sort of behavior change support, that coaching sort of support. There's never going to be enough psychologists to go around in the NHS anyway, because there's such a burden of mental ill health and dementia and all these other problems. So there's very few people like me that actually work in health settings. Some diabetes teams now do have psychologists, but of course, on the whole, they're not doing low carb. They are supporting people in behavior change, but we might say, is it the right behavior change that they're bit controversial. So I think we can do a lot I think we can do a lot without psychologists. I think where the NHS could do, and everywhere could do so much better, is in recognising food addiction and eating disorders and the distress that causes, and giving some better advice around that, and pointing people in the right direction. At least it's just not something that's recognised at all really in the UK, and we do think now from prevalence studies that it's 20% of the general population is the latest figures. So that's 8.6, nearly 9 million adults in the UK alone have probably got some kind of addiction problem. And when you walk around, you think that probably is true. When you see people, compared to what the population used to look like, I think a lot of people are having these food struggles.
It's tough. So let's talk about Fork in the Road. This is your book. Yeah. Congratulations. Isn't it like
my lockdown baby? It's a very simple book, and it's the book that I wished was around when I'd been a teenager, because I would have learned all about the perils of high sugar diets and not only what it was doing to my body, but what it was doing to my brain, more importantly, which I had no idea about. And I think if I'd known the damage that sugar and high carb diets can do to the brain, I would have definitely been able to make the change sooner. Yeah, so all profits to the Public Health Collaboration, and it has got comments in it from people like Bitten Johnson and Georgia Eade. I don't know if you've come across Georgia Eade. She's a psychiatrist, nutritional psychiatrist in America. Oh, you look her up.
Okay.
She's all about nutrition and mental health, basically. So so there's some comments from my fellow professionals who are also fellow food addicts themselves, and there are some recipes, and they're very in line with the Real Meal revolution style.
Are they?
Real food.
So who's the book for?
Yeah, any to be honest, anybody, like a professional could read it. It's more really aimed at someone in the public who feels that they have this problem, and some early steps to go about it. And there's resources in the back as well. So I explain in there about the brain chemistry. There's a little quiz like, does it look like you have a problem with addiction to sugar and food? Then what to do about it, and the recipes and resources and so on. Yeah, and there's so
you got 179 reviews on Amazon, and they're all very good.
And
I lost you for a second there.
That has just come out, a journal, which is a 100-page journal, as a sort of follow-up to the book. So if you want to, it can be quite useful to sort of, make yourself a food plan and a plan to stick to, and then reflecting on how that's working for you. And so it's a 100-page journal to sort of keep yourself on track, if you like, and try and evaluate where you're up to.
That's awesome. Yeah, so I put the link into all of the streams. We're going to like 5 different destinations, and then so anyone who wants to go and get this book, click on the link in the comments. You'll see I've just dropped it in there, and go and buy the book. And you said that all the funds or the royalties go to the Public Health Collaboration, which is with Sam
UK, that David and I were sort of founder members of.
Okay, now what does that collaboration do?
It's really campaigning for better public health advice than the public health advice that we currently have, which is the sort of eat well plate, which wouldn't apply well at all to particularly people with type 2 diabetes, but arguably the rest of us as well. And it's sort of trying to disseminate good quality public health advice.
So what, you all go out on with placards, or do you try and network with I know that Asim, because Asim Malotra's on the board as well. So he goes to Parliament every now and then and causes a bit of a stir. But what else is happening?
He's chair of the scientific committee. We have a conference year, and all the YouTube videos from all the speakers are available, free of charge. But if they're useful, please give a donation to the Public Health Collaboration. you'll see that there's booklets and leaflets in the resources section that you can download. There's a few pages on food addiction. And then there's a whole fantastic tribe of PhD ambassadors who are folk in the UK who are dedicated to this cause, and they go out and pester their own GPs and people locally, or they set up, quite a lot of them have set up their own groups locally. There's a project called TLC, which is the Lifestyle Club, where coaches are trained to run type 2 diabetes reversal sessions within GP practices. So they're out spreading the word, getting amazing results. You don't have to be David Unwin to get these good results, as long as people are having the right advice. And and obviously with all the caveats around, if you're going to radically change your diet, check which medications you're on before you do that, because some of them you do need to have some advice about before you go really low sugar diet if you're on medication. Don't want anyone to keel over.
Totally. Well, Jen, it's been amazing chatting to you. Thank you so much for making the time, and congratulations on your book again. For those of you watching, it is called Fork in the Road: A Hopeful Guide to Food Freedom by Dr. Jen Unwin. And go check out the public health collaboration and go pester your doctor. Tell them to start promoting low carb to people with type 2 diabetes, because anything else is murderous. So Jen, thank you so much again for your time. It's an absolute pleasure, and we'll hope to have you again soon.
You're welcome.